Can plastic surgery anesthesia cause long-term brain fog? Imagine going in for a cosmetic procedure and wondering if the anesthesia might leave you feeling foggy or forgetful long after recovery. That's a common concern, but let's look at what science actually says. Long-term brain fog after plastic surgery anesthesia, known as postoperative cognitive dysfunction, is recognized but quite rare, especially in healthy, younger patients. It's more common in older adults or those with existing cognitive issues. While general anesthesia itself isn't conclusively proven to cause lasting brain fog, some factors related to surgery and individual health can play a role. Research shows that cognitive issues like memory problems or difficulty concentrating after surgery are usually temporary. These symptoms often appear in the days or weeks following the procedure and tend to resolve within a few months. The key is understanding that anesthesia alone is unlikely to be the main culprit. Instead, the body's immune response to surgical trauma can trigger brain inflammation. This inflammation activates immune cells in the brain, which can temporarily impair mental clarity. The duration and severity of cognitive changes depend on several factors. Age is a significant one. Older adults, especially those over 70, are more vulnerable to cognitive fluctuations after anesthesia and surgery. They may experience more noticeable brain fog or memory lapses, often unmasking underlying issues. Other factors include the length of the surgery, overall health, vascular health, and whether the patient has pre-existing cognitive conditions. The context of plastic surgery: procedures tend to be shorter and involve healthier patients compared to major surgeries like heart or joint operations. This generally lowers the risk of long-term cognitive effects. Most people recover fully within days or months, and studies suggest that after about 3 months, cognitive function is usually back to baseline. Persistent long-term brain fog is very uncommon and often linked to other health issues, not just anesthesia. It's also important to consider that modern anesthesia techniques aim to minimize risks. Anesthesiologists carefully tailor their approach based on the patient's age, health, and the type of surgery. For older patients or those with cognitive vulnerabilities, preoperative assessments and monitoring can help reduce risks. These evaluations can include cognitive testing before surgery to identify any potential issues early. If you're planning a plastic surgery procedure, discussing your medical history with your surgeon and anesthesiologist is essential. They can help you understand your personal risks and what steps are taken to ensure a safe recovery. Remember, most cognitive changes after surgery are temporary and part of the body's natural response to trauma and inflammation. Long-term brain fog caused solely by anesthesia is very rare, especially in healthy individuals. Always seek advice from qualified healthcare professionals to get personalized information and reassurance.